So how do you kinesio tape a knee? In this video, you're going to learn how I kinesio tape knees in my practice for general knee pain, as well as a few tips and tricks that doctors use to make kinesio taping easier. Hey guys, what's cracking? It's Dr. Neville, aka Dr. Ginger Ninja, aka the Firecracker Chiropractor. And on this channel, we demonstrate different types of chiropractic treatments. We do periodic medical product reviews, as well as how-to videos just like this one. So if you're new here, consider subscribing and make sure you ring that bell so you never miss one of our videos. Any products that we use during the videos will always be listed in the description below. With that being said, let's get cracking. So what is kinesiology tape? Kinesiology tape, also called Kinesio Tape, is an elastic therapeutic tape that helps support joints and muscles. It can be found on both professional and recreational athletes, but gained a lot of popularity during the 2008 Olympics. Kinesio tape is different than traditional athletic tape because of the elastic properties as well as the wave adhesive pattern on the back. Instead of restricting movement like traditional athletic tape, Kinesio tape adds support to the joints and soft tissue while still allowing full range of motion. So the first step in kinesio taping a knee is making sure the skin is prepped and clean. Kinesio tape naturally doesn't like any oils or lotions, so use a little bit of alcohol to make sure that the skin is prepped and clean. For today's taping, we're going to use 4 14-inch strips of tape as well as 2 10-inch strips of tape. Pro tip number 1 is to round the corners of the tape, and you will find that it won't catch on clothing and it will last longer. Pro tip number 2, to remove the tape from the paper, don't try to peel it from the edge. Instead, tear the paper from the back and then peel away. To start taping, make sure that the ends are never applied with tension. So what we're going to do is remove the back of the paper from the end. I'm going to apply the first strip on the lower leg, and we're going to be pulling at approximately 40% tension. So the tape is going to come around the medial patella and come right up the quadricep, and then the end is applied with zero tension. We're going to do the same. Rip the end of the tape, apply that with zero tension, and we're going to come around the outside of the kneecap this time, and then up the quadricep again with no tension at the end. Then we're going to apply the 2 10-inch strips to the medial and lateral sides of the knee for extra support. So again, the ends, no tension. We're going to bring this up approximately 30 to 40% tension along the outside of the knee to support the lateral collateral ligament. And we'll do the same along the inside of the knee for the MCL. Pro tip number 3 is to make sure that you rub the tape to activate the adhesive. That way you will find that the tape sticks and lasts longer. If your knee pain also has hamstring involvement, you'll want to kinesio tape the hamstrings as well. So to do this, we need to first stretch the hamstrings, and instead of bringing the leg up, you can also have your patient bend over at the waist to stretch the hamstrings. You're going to apply the end with zero tension on the top of the calf, pulling at approximately 40% tension along the medial hamstring. Apply the end with zero tension, and we will do the same for the lateral hamstring tendon as well. Applying the end with zero tension, pulling at approximately 30 to 40% tension, and again rubbing that tape to activate the adhesive. In today's video, we just demonstrated one way to kinesio tape knees for general knee pain. but actually there are a lot of different ways to kinesio tape knees based on specific injuries, which leads me into the question of the day. Have you ever used kinesio tape for knee pain? What have your experiences been? Let me know in the comments below. And if you found this video helpful, punch that like button, subscribe, and we'll see you in the next video.